Hi, I'm Dr. Kit Weathers, and it's time for the Root Tip of the Week. Excuse me, I'm just a little bit thirsty. That's better. You know, I've often thought it's just as important to seal the coronal portion of a root canal as it is to seal the apical portion. As a matter of fact, studies have shown that it is more important to get a good coronal seal than a good apical seal. And excuse me just a minute, this telephone is always driving me crazy. There's a picture of my balloon in there. I'm just going to have, no, instead of answering it, I just wish there was some way I could put it inside this bottle so I wouldn't have to listen to it anymore. But you know what? There actually is a way. Let me show you how we got that cell phone inside of that plastic bottle. To learn the secret to this and other magic tricks in this series, go to EndoRootCamp.com. As a matter of fact, it doesn't always have to be a cell phone. You could even use the bottle cap if you wanted to. Just take it and push it in the hole in the end. And there's your bottle cap in the bottle. The secret is the same for the bottle cap or for the cell phone. Anyway, it's a lot of fun. It's called the coin in the bottle cap in the bottle, or my personal favorite, the cell phone in the bottle. Well, I have a very special guest in the studio with me today, Dr. Ron Jackson. Ron knows more about bonding composite and sealing dentin than anyone I have ever met, so let's ask him what would be the best material and the best technique for sealing the coronal portion of a root canal.
Okay, so the question is, immediate dentin seal, or sealing the pulp chamber using the technique that we do for aesthetic inlays and onlays at the preparation visit, using an adhesive followed by a flowable composite. Would that be of value after endodontics? Would that be of value? Well, of course, without the pulp there, we don't have to. We're not considering the comfort of the patient in terms of sealing the dentin. They'll have no sensitivity, so we're not doing it for that reason. But I think the best reason for applying the same type of procedure to the non-vital tooth, the one where the endodontics has just been performed, that we do to a vital tooth, to the dentin, the immediate dentin seal technique, I think the importance of doing it is to prevent the bacterial ingress into the pulp chamber and down the gutta percha and eventually reaching the apex. My understanding is that science has shown that during the provisional phase, same thing's going to occur whether it's vital or non-vital. If the dentin hasn't been sealed, all provisionals leak. They contain bacteria which have now access to the dentin, and in the case of an endodontic tooth, why via the cement and the gutta percha, why it can infiltrate. And my understanding is that within a month, if the provisional is there that long, and sometimes that is the case, that these bacteria can reach all the way to the apex. So there's certainly no harm in doing it. In fact, there may be a lot of good in doing it, and there might even be a restorative value when later on you restore, whether it be an indirect restoration or a direct composite. Once again, the restorative value is that if it's an indirect restoration, it can act as an elastomeric and reduce the polymerization shrinkage stress of the luting resin. So I think it's a good idea to follow the endodontic procedure with the same immediate dentin seal technique that we do for vital teeth.
So Ron, in a situation like this, would you ever consider using a self-etch primer? And in 2 minutes or less, could you describe your technique for sealing the pulp floor in a tooth that's just had a root canal?
I would prefer to do a self-etch adhesive, to use a self-etch adhesive. And at this point in time, my recommendation, what I would use, what I do use, would be Adhese is a good example. Adhese is a two-step self-etch from Ivoclar. The first bottle is a self-etching primer, and the way that's applied is in two separate 15-second applications, agitating with the applicating brush 15 seconds each coat. Following a second application of, you would dry that, and then the second bottle is organic bond resin, just unsolvent, no solvent. Place the bond resin in a thin layer, cure that, and then I would reach for a very high flow or very low viscosity flowable. An example might be Tetric Flow from Ivoclar, which is also has the advantage of not only high flow, it's very radiopaque. And once you've cured that, just use alcohol sponge to wipe off the air inhibited layer and then place the temporary.
So is this basically the same technique that you would use in the immediate dent and seal that you describe in your lectures?
Yes, it would be the same technique, but I'm not so sure that sealing the floor of the pulp chamber after endodontics has been done, I'm not so sure is you'd gain the same value, since there's actually no pulp already there. You're certainly not protecting the pulp. The patient's going to be comfortable. However, having thought through this, what I can say in terms of sealing the pulp chamber with an adhesive and flowable after endodontics, what I can say is that I think your restoration will benefit once again from the elastomeric effect of the flowable that's been cured in the bottom of the preparation. When your luting resin is cured and shrinks, the shrinkage stress will go to the flowable and not so much to the bond to the dentin. How much value that would have, I'm not so sure, but I think it would have restorative value, but obviously not a pulpal value.
Well, thanks, Ron, for spending a few minutes with us today. Most of you don't realize it, but we just did a 1-hour webinar for the IACA, and I know Ron's tired, and for him to give that little presentation just right off the top of his head, he had no idea what the questions were I was going to ask him, and I thank you very much. Well, that's it for another Root Tip of the Week. I'm Dr. Kent Weathers, inviting you to join me at our very next Root Camp. So long for now.